Hey, good morning.
Hey.
My name is Bea. I'm going to be your nurse today. And I'm going to be performing some assessments, nursing assessments that we need to figure out if everything is okay, and the doctor will also come in and take care of you. Okay? All right. Now, first of all, I need you to tell me your name and your date of birth.
Vincent Patient. I was born June 19, 2001.
Thank you. And that's what we have on your name band here. So to start my assessment today, I'm going to ask you to please sit up if you can and just swing your legs over to the side of the bed here. Okay, Vincent, are you sitting comfortably?
Yes.
Yes. Okay, I'm going to ask you to remove your shirt for me if you can. Just so that I can look at your skin and make sure that everything is okay. All right, as I'm looking at your skin, I see your skin is smooth. The color is consistent with your ethnicity. I don't see any cuts or bruises, no lesions, and I can see you're relaxed. You're sitting comfortably, and you're breathing normal in a regular, non-labored fashion. And I see your AP to transverse ratio is 1:2, which is a normal chest ratio. Okay, I'm just going to feel your skin and kind of pat you down just to make sure there are no bumps on your skin. Now, is there any pain as I'm touching you?
No.
No pain at all. Good. Okay. I'm just coming down, just looking at your skin, your hands. You can turn around. Good. And then I'll look at your nails. There's no clubbing noted, and the cup refill is normal at about 1 to 2 seconds. I'm gonna go ahead and feel for your radial pulses here. Just relax, breathe normal. And I can feel both your radial pulses. They both feel regular at about a +2 on both sides. I'll go ahead and feel for the brachial pulses right here. Very good. Easily felt, and they are both even equal on both sides, and they also feel regular. All right. Now I'm gonna ask Vincent to swing his legs over to the other side of the bed, but on a patient on an exam table, I would be going around the table. Okay, Vincent, do you want to turn around? Okay, let's sit back. Move back a little bit, just so that I can. Thank you. All right. So I'm gonna do the same thing, and I will also inspect his skin on the back, and I don't see any irregularities. The skin is even. There are no lesions, no cuts. Yeah, the skin looks healthy. It's not clammy. And I'm just palpating, the back area, just to make sure there are no bumps. Any pain as I'm touching your back like this?
No.
No pain. How about here?
No.
No pain. Good. Good. Now I'm going to assess for the symmetry expansion, and I'm going to put my thumbs on around the T9 or T10 area. And Vincent, I'm going to ask you to take a deep breath in through your mouth and deep breath out. And breathe out. Thank you. One more time. Thank you. There is symmetry. My thumbs are raising up at the same time. And while I'm on Vincent's back here, I'm going to percuss his back on all lung fills. Okay, Vincent, I'm going to tap on your back here. It shouldn't hurt, but if it does, do let me know, okay? Start from this side. All right. Let me know if it hurts. And on normal lungs, you expect to hear a resonance sound, which means there's air, and that's what I am hearing. Right. I'm also going to percuss the costovertebral angle, and in doing this, I'm assessing for the costovertebral angle tenderness, and this can be as a result of inflamed kidneys or pyelonephritis. And if the patient feels uncomfortable as I percuss, then we should assess further for kidney inflammation. Put my hand on the costovertebral angle by the kidneys, and I will just pound. Any pain when I pound on your back like that?
No.
Okay. This side?
No.
Good. And that's a normal finding. There's no pain, so that is good. While I am at the back here, I will go ahead and listen to the posterior chest lung fills. So Vincent, when I move my stethoscope, I want you to take deep breaths for me. And if at any time while we are doing this you feel dizzy, lightheaded, let me know so we can stop. If you can lift your hand up, and I will know you're in pain. When I'm asking you to take deep breaths, if you lift your hand up, then I'll know you're getting dizzy or lightheaded, and I will stop. Okay? All right. This is done using the diaphragm part of the stethoscope, and I will start by listening up here. Take a deep breath for me. Good. Through your mouth and out through your mouth. Deep breath. Good. Deep breath in. Another one. Good. Deep breath. Deep breath. Another deep breath. Another one. Okay. One more. Okay. I'm gonna go to the right side here, and I'm gonna listen to the right middle lobe. And to do that, I'm gonna ask my patient here to put his right hand up, just like this. Good. And I'm gonna listen in the middle here. Take a deep breath in through your mouth and out. One more. Good. Thank you. All right. Now I'm going to ask you to turn around and face me so we can do the front. All right, so I'm going to go ahead and listen to the front chest, and I will also listen the same way for the lung sounds. So I'm going to need you to take a deep breath in through your mouth and out through your mouth as well as we go along. Okay, deep breath in. Deep breath in. Deep breath. Good. Deep breath in. Deep breath. Good. Deep breath in. Good. Good. Last one. Okay. The lung sounds are all clear throughout all the lung fills. There are no crackles that are heard anywhere, and there are no other adventitious sounds that could be heard on any of the lung fills. He's breathing regularly. He's not using his intercostal muscles to breathe. There's no retraction of the sternal notch, so his respiratory status is all normal. I'm gonna then continue and palpate his carotid artery, and after that I will auscultate the same. I'm just gonna touch your neck here, and I'm gonna feel your carotid pulse right over here. And to do that, I do one side at a time because I do not want to occlude and prevent blood flow, arterial blood flow to the brain. So. Good. And now I'm going to go ahead and listen at that area. I'm going to use the bell of my stethoscope here. Okay, I'm going to ask you to hold your breath when I'm listening, and I will hold my breath too, so we're doing it at the same time. Thank you. I'm going to ask you to hold your breath again. All right. Thank you. You doing okay?
Yep.
Good. And I was able to palpate and auscultate the carotid artery, and it is regular. There's no turbulence, no bruit, which is a normal finding. If there was to be signs of occlusion on that artery, then I would be hearing some turbulence as the blood is trying to flow through an occluded artery. So I will go ahead then and listen to the heart. And to do that, I'm going to ask you to lie down on your back. And we will listen to the way your heart is beating. Are you comfortable?
Yes.
Okay, so I need you to breathe normally. You just breathe regular. You do not need to do anything. I'm just going to listen to your heart. Okay, I listened to 4 landmarks. The first area was the aortic area, which is on the right second intercostal space. That's where you listen for the aortic pulse. And right on the opposite side of that, on the left intercostal space, is the pulmonic area. And on these 2 areas, the S2 is usually louder than the S1. And then I came down and listened at the Ebbs point, where both the S1 and the S2 sound the same. I came down around the 4th, 5th intercostal space, and I listened to the tricuspid area, and the S2 is louder than the S1. And then towards the apex of the heart, left 5th intercostal space, around the mid clavicle line, I listened to the apex of the heart for the mitral valve, and the S1 is also louder than the S2 at that area. And that's all our heart sounds. Okay, I'm gonna go ahead then and continue and assess your abdominal region. The first thing I'm going to do is to inspect your abdomen. And from where I'm standing, I can see your stomach, your abdomen is flat. It is symmetric. There are no apparent masses. I do not see any striae. There are no old scars. There are no lesions. And I don't see any pulsations either. And your umbilicus is also normal. I'm going to listen to your abdomen for bowel sounds. So just breathe normally. Are you in any pain?
No.
Any pain on your abdomen?
No.
No pain. Okay. All right. I'll start from the right lower quadrant. Good. Bowel sounds are present in all 4 quadrants. And now I'm going to go ahead and percuss the abdomen. So I'll start again from the right lower quadrant. Let me know if you feel pain. You shouldn't be feeling pain. Any discomfort as I do that?
No.
No discomfort, okay. Any discomfort?
No.
No. Okay, I'll continue on and I will palpate the abdomen. Now I'm gonna push on your abdomen and please do let me know if it hurts. First, I'll press on your stomach lightly and then I will press a little deeper, okay? All right, I'll start on the right lower quadrant as well. So just lightly. Any pain?
No.
Now deeper. Any pain?
No.
No. Lightly. Any pain?
No.
Deeper. Any pain?
No.
No. Any pain?
No.
Any pain? Deeper?
No.
Okay. Lightly. Any pain?
No.
Deeper. Any pain? No. Good. Okay. There are no masses that were felt and the patient did not feel any pain, which is a good sign. So his abdomen is normal. Okay, to palpate the liver, I'm going to put my left hand on the back of the patient, parallel to the 11th and 12th rib. And with my right hand, I'm going to place it on the right upper quadrant. My fingers are parallel to the midline. And I will push deeply on the right upper quadrant, just below the costal line here. So I'm just going to press down. Nice long breath. Thank you. Now when I press deep, sometimes I can feel the edge of the liver as he breathes in, when the liver then is being pushed down by the diaphragm. But in this case here, I did not feel anything, and that can be a normal finding. And sometimes it's possible to be able to palpate the edge of the liver. So next I will palpate the spleen. Now the spleen is on the left upper quadrant, and for me to be able to palpate that area properly, I'm going to ask you to move towards me, just so I can have good body mechanics here. Just move your hips one more time. Perfect. Okay. All right, I'm going to put my left hand on his back here, the same way like I did for the liver, just parallel to the 11th and 12th rib. And I'm going to lift up. You don't need to lift yourself up. I'm the one doing the lifting. So then I will lift up, and with my right hand facing the axillary line under the intercostal space, intercostal line too, I'm going to press down. Take a deep breath for me. Deep breath with your mouth. Good. And as I push down, I shouldn't be able to palpate the spleen, but if the spleen were to be enlarged, then I would be able to palpate it. Now, if I'm palpating for the spleen and I actually feel the spleen, I should stop palpating because I do not want it to rupture. I should immediately let the provider know. All right. Now, before I go on, I'm just going to demonstrate where we would find the femoral pulse. So the femoral pulse is going to be right in this inguinal area, and if it will be felt right there. Okay? Thank you. And same thing on this side, just on the inguinal area here. You feel the femoral artery. All right, we'll go ahead then and do the lower extremity assessments. So I'm going to move your pants up, if that's okay, just up to there, like that. There. Then I'll take your socks off for you here. Should have taken them off at the beginning. This one too. Alright, now the first step is inspection. I will inspect the lower extremities just to make sure there are no open areas and the skin looks intact on both legs. There are no varicosities, there are no rashes or lesions. The skin is clear, it feels warm to the touch, it's not clammy, it's all normal findings so far. Alright, so I'm gonna go ahead and look at his toenails. There's no cladding, they look okay. His feet look okay as well. They're not dry, no open areas. Okay, I will go ahead and look for any pre-tibial edema. Push down. I don't see any pitting. This side too. No pitting. So no edema. Circulation seems to be normal onto the lower extremities. And I will go ahead now and palpate for the posterior tibial pulse. Now the posterior tibial pulse can be felt just below the medial malleolus. Alright, I can feel that one right there. Good, I can feel them both. They are regular. They were not very easy to find, but I can feel them now. Okay, then I will come on this side. I need you to relax, just relax your feet. Alright, and then I will feel for the dorsopedal pulse. Now the dorsopedal pulse is found, if I follow the tendon of the great toe here to the groove here, I should be able to feel, and I feel it right away. Good. Same thing on this side. Relax your foot for me. Thank you. And there we go. Good regular rate. It's not bounding. It's a regular pulse. That concludes the end of our exam today. Vincent, is there anything I can do for you before I go? No. Okay. Now here's your call light. Let me know if you need anything and I'll come back. But now I am going to let the provider know and they can come and also check on you. So put your shirt back on and I will be right outside the door if you need anything. I'm going to go ahead and listen to your abdomen using my stethoscope. I will use the diaphragm side.